Thank you for tuning in to watch the impact of cultural compacts in promoting creative health activity. This event is brought to you by our Midlands Creative Health Associate Jane Hurst in partnership with Vibrant Shropshire and University Centre Shrewsbury. It's part of a 4-part series of roundtable discussions showcasing creative health leadership in the Midlands and beyond. To access other event recordings in the series, please visit the NCCH website at www.ncch.org.uk and view our blog pages. Now, without further ado, let's introduce the panel.
Hello and welcome. So I'm Jane Povey, another Jane. I'm here to facilitate this discussion, so I'm not one of the experts like these guys. I'm a GP by background, been living and working in Shropshire for the last over 25 years now, involved not just as a GP but in leadership management roles, trying to shape services to work better for our community that we are as well, and us. And have been a creative health groupie for some time now, including going back about a decade or so where we were in this very room and a network called Creative Inspiration, trying to develop an ecosystem around here to connect people needing creative health with solutions. I chair the National Centre of Creative Health Champions Network, where we're trying to get people in influential positions in health and care services to understand and use creative health better. And I'm one of the board members of our Cultural Compact here. So this is a fantastic opportunity just to get together and just have a bit of thinking time, sharing time, and so exciting to actually literally be here together. And thank you for coming to Shropshire, and hope you'll have a useful afternoon. So we're just going to do introductions. I think the question really is, yes, tell us who you are and how you got involved in this Cultural Compact thing. And then it's really open to everybody. Panellists might have questions, but how can we use the expertise in this room, which you are as well, to explore what Cultural Compacts are, where they've come from, where they're going to, and how they can start enabling creative health, because clearly a lot of Cultural Compacts wouldn't necessarily have started with predominantly creative health in mind. It's definitely a priority of Shropshire's now.
Thanks.
So let's start at that end then.
Oh, terrifying.
So yeah,
I'm going to wish they hadn't sat next to me.
How did you get here?
So I'm Gemma Thomas. Hello, everybody. And my day job is the director for Appetite, which is the Creative People and Places programme for Stoke and Newcastle-under-Lyme. It was one of the very first Creative People and Places programmes, and that's been running since 2013. We, as Appetite, has collaborated with our University Hospital of North Midlands over the period of time, embedding some projects within the hospital at this Royal Stoke site. So I feel like I have a little bit there, but also, mental health partners are part of our programme, and we do a lot of community decision making, and the Cultural Compact is called Stoke Create, and that includes 2 universities, to which one of them has got a social inclusion institute, the other one has a participatory decision making and a creative industries institute too, so they're on there with us. I got to the compact a little bit later than the people who formed it, so we're building on the shoulders of David Amagoni, who is the Keele University person on our board, but also Nikki Twemlow, who is from the YMCA, who has really forged this forward. I'm also on the peer learning steering group for Arts Council's place-based peer learning group, which is for ALSEP's Creative People and Places programmes and Cultural Compact and the wider sector to learn from each other about working in place. So I thought that was an important thing to say here, because actually everybody might want to be part of that, and it's open to everybody.
Fantastic.
Yeah.
No, that's brilliant. This is going to spark off so many questions, so, lovely.
Right stuff, I think it's me next. Okay, can you hear me? Yeah, great. So, hi, I'm Vicky Hines. I'm the Chief Exec of One Walsall. We're a voluntary sector membership organisation, and we were asked to host the Walsall Cultural Compact. We're actually going through a bit of a reboot. So our compact actually started back in 2020, or just before the pandemic, and it was actually hosted at that point by the University of Wolverhampton. Unfortunately, because of the compact, there was a lot of slow progress, and it fell by the wayside, if we're honest. So the relaunch took place last year, where we've actually reinvigorated the compact board. We've brought together a number of different organisations to our compact, so that includes health. My colleague on the panel, Helen, will tell you a bit more, but we've got health as well as housing, education, arts, organisations all involved. And we've also got some subgroups now, which make up our marketing and communications group. We've also got a data and mapping group. And we've also then got, which is probably more important actually, a creatives group in its own right. So we're bringing together creatives onto that group. But I think, just as Gemma was saying, I think it's that sort of broad aspect of culture and how it can support a lot of wider themes. We know that health and well-being is a massive issue for us in Walsall. So there are issues around things like dementia, cancer, diabetes, and looking at how we can bring that sort of cultural aspect to the work that we do. We also have a very diverse community as well, and I think what we're seeing is a new and emerging population of people coming into Walsall, so looking at ways in which they can be engaged in the work that we're doing. As I say, we're quite new, so some of the things you've talked about, Gemma, we're sort of way behind you, I think, in terms of what we're doing, but one of the things we're looking at is a cultural compact strategy, which will guide us in terms of forming priorities and what have you. So we're just at the start of that process of bringing that together. I'll leave that there.
Thanks, Vicky.
Thank you.
Paul, next.
Hi, I'm Paul Gossage, and I work for Shropshire Council in the role of Project and Marketing Manager within the Culture, Leisure and Tourism team. It fell upon my shoulders to set up a cultural compact when I first joined the council about 2.5 years ago. And I have to say, at that stage, I was totally unfamiliar with the whole concept. But thanks to sort of a huge amount of consultation with people who had already established cultural compacts and sort of a lot of desk research, I really began to see the importance of how cultural compacts can make a tangible difference within communities, always using culture for the lens. And what it helps do is to remove my opinion about culture. It's not culture for culture's sake. It really is how culture can change a place through its economic development, through skills development, through enhancing people's understanding of climate change, and most importantly, why we're here today in terms of creative health and well-being. It wasn't until we had a presentation from Jane behind the camera here where I suddenly realised I'd been part of creative health myself as a consumer. Hadn't really realised this grandiose term, what it meant. And it really is something that probably we all have experienced in our time, whether it's going to the theatre with friends to overcome isolation, you need to laugh so you go to the cinema, you go out for a run in nature to overcome some mental health issues. It's something that's very simple, and I think sometimes the danger is that we overcomplicate it. Having sort of understood what cultural compacts we're here to do, we then went as a sort of a team to establish it, and it's thanks to Paul, to Jane, and other colleagues in the room who helped me establish a board. That board's made up of a cross-section of sectors, naturally culture at the heart of it, but we've also got education, the health and wellbeing sector, and business, amongst others. And we've picked up the cultural strategy for Shropshire, and that is fundamentally our guiding light. We are here to actually start to help deliver that cultural strategy, and looking at some of those priorities that I've already referenced, such as raising awareness of climate change and how we as a sector can address that, work in a more sustainable fashion, look at how we can develop skills, encourage more young people into the sector, look at greater opportunities for volunteering, but also looking at the economic value of culture, not only in terms of the initial direct benefit, but also the additional benefit brought through the hospitality industry, through shops, even through the likes of petrol stations, people filling up before they go in or leave an event. So it really is picking up on that grand model that started with sort of the national or the international cities of culture, using culture to bring a destination or a place together and use it to make a really meaningful difference in that area. Since that day, I'm delighted to say we secured funding to recruit Alice, who's our Cultural Compact officer, who, without Alice, none of this would happen, because if anyone's under any misunderstanding, these things don't happen by accident. There's a huge amount of hard work that go into them. But subsequently, we've secured additional funding. That means that we're now able to actually not deliver, but enable the sector to fulfil our priorities through a series of small grants £1,000 to £5,000, which we secured 130,000-ish thousand off the UK Shared Prosperity. Thank you.
That's brilliant. Claire?
Well, that was so much information.
Yeah, we're all going to be there. We haven't died down after, don't worry.
So I'm Claire Purcell and I represent Herefordshire Cultural Partnership, and I'm a director of that, but my day job I'm director of a contemporary visual arts charity called Meadow Arts, who've been going about 25 years, and we cover Herefordshire, Shropshire and Worcestershire. Herefordshire Cultural Partnership had an interesting beginning because in 2016 Herefordshire bid to be the 2021 City of Culture, and as you'll know, Coventry got it. And Coventry compared to Hereford seems a bit bonkers, but Herefordshire was the only rural city to make it to the shortlist, and that was significant because the energy that went into putting together a City of Culture bid formed a group that then didn't want to stop going. And so in 2018, Herefordshire Cultural Partnership became a limited company, limited by guarantee. And what makes us a bit different from other cultural compacts is that we're independent. We meet quarterly, and we're very much committed to cross-sector partnership. And Herefordshire Council have now joined us in more of a way than they were originally, and I think it's really, really helping the local authority value culture. We all know, the terrible things that happened under austerity. Herefordshire used to have a great arts and cultural department. It all went. There was this funny sort of feeling for a while that we were all a bit adrift, and what happened, in a way it was good because the arts and cultural sector then just got spurred forward to really make a voice for themselves, and now that's slightly coming full circle, and the local authorities are recognising that the impact, the value, everything we know about arts and culture, and so they're a really great part of the group. But also on the group, I've set up because Meadow Arts are a national portfolio organisation, that's an Arts Council thing, which means we're kind of clients of the Arts Council. Herefordshire's got 6 such organisations. Collectively, we bring in thousands to the county every year just through that one funding stream. Also, Shropshire has some great NPOs, including now Shrewsbury Museum and Art Gallery and Pentabus, who've been going 50 years. So I started these NPO networks, and they are represented on the Cultural Partnership. There's also a really nice group that meet in Hereford called the Hereford Herd, and that's a networking group for creatives, particularly now welcoming young people, because we have Herefordshire College of Arts, which is one of the few remaining independent art colleges in England. Previously, when we had more of a manufacturing sector, there were 38 art colleges in the West Midlands. Now there's about 2, and there's only one that's independent, that's Hereford. So recognising talent development, trying to keep the skills and energy of young people in the county. The Herd is a kind of networking group for that. And we also represent the local cultural education partnership and other schemes that have come about through funding, such as Creative Pathways, which was a big volunteering scheme. So our chair, Nick Millington, who a lot of you have met because he's brilliant at networking and he's already come here, but he now has been appointed by Arts Council as one of a few people that are really looking into this whole kind of growth area of networking and cultural compacts and people coming together. So in answer to Jane's first question, why did I get involved? I think I got involved because I really, really believe in the importance of supporting each other and working together, and it's tough out there, and I've just found from setting up the NPO networks alone that you might only meet for an hour once a quarter, but you come away thinking, wow, collectively what we're doing is really amazing, and none of us really have enough time to blow our own trumpets, and I think there's something about coming together and celebrating what we all do that makes us able to share that and shout about the impact of what we do more loudly.
Brilliant, thank you. And I think, you're beginning to get the flavour. We're going to get lots of different things from each compact and each individual, and that will help us build the conversation. So that's great. So I think we're now on to Warwick, aren't we?
Yeah, hi, I'm Emma Andrews. I am the Service Manager for the Museum, Arts and Archive Service for Warwickshire County Council. I also sit on the Warwick District Creative Compact, who I'm representing today, and I also chair the Coventry and Warwickshire Creative Health Alliance, so that's kind of where the creative health bit comes in. So the Warwick District Creative Compact, as it's called, was first set up in 2017 by Warwick District Council, led by Jonathan Branson, who some of you might have met Jonathan. I'll be honest and upfront and say actually the priority for the Warwick District Creative Compact is not creative health. The primary driver was around economic development, economic vibrancy, and particularly post-COVID, looking at supporting creatives, freelancers, and some of the creative businesses, particularly in Leamington and Warwick. So there have been a number of strands of delivery over the last few years. One particularly around capital development. So Jonathan and the team have been working on the new cultural centre for Leamington in the south of the town, and looking at start-up spaces for creative businesses, and trying to develop much more of a creative quarter in the south of Leamington. That has then kind of spilled out, and we're working on a project at the moment to sort of revitalise the main high street in Leamington, the Parade, and particularly looking at new uses for our town hall building. We've recently moved Motion House, who's one of our MPOs in the area, into the town hall, hopefully as a catalyst to sort of generate more creative activity in the centre of the town. So certainly the economic development side of things has been a massive driver, and the partners that sit on that creative compact have included businesses, the Business Improvement District, as well as HEFV and creative businesses within the town. So that's been kind of the central tenet of our creative compact. Also a really big drive to support creatives and freelancers. So we have an event annually now set up called A Spark, and a secondary event called Ignite, where we look to put on training, development, professional development opportunities for our creatives in Leamington and across the district as a whole. So over the last sort of 4 to 5 years, we've seen quite a lot of initiatives. We've managed to access funding and support for those either individual creatives, freelancers, or for artists, arts organisations and other creatives in the district. We've sort of hit a bit of a pivotal point in terms of the life of the compact. Since COVID, I mean, we had quite a big membership to start with, and that sort of slightly shrunk as time has gone on. I mean, Alice, you'll know, sort of, it needs legs, you need resources and you need funding, and we sort of reached a point probably about a year or so ago when we really needed to look at what the future was for Warwick District as a compact. We've got lots of support, and as a district, the District Council are incredibly supportive of the compact, but we needed to look at its governance and how we drove it forward in the future. So we actually managed to achieve some funding from Arts Council to bring in some consultants to work with us, to look at undertaking some research to see actually what is the next stage for us. So while we delivered some really interesting projects, we've achieved some funding, we've had some really good outcomes, in terms of that kind of a long-term future for Warwick District and its creative compact, actually where were we going next? What was our next step? What did our creatives and our businesses actually want from that? And I think, as you've already alluded to, as resources are shrinking, people are not able to potentially give the amount of time to the compacts that they maybe would have done in the past, because they're all either running their own businesses or got their own things to do. So we've almost completed that piece of research. We're just waiting for that final report and recommendation to come through. So that's kind of where we are as a compact. In terms of creative health, as a county, we're very active, we're very supportive, and obviously as a county council, we're keen to support creative health as a whole. We've supported the Creative Health Alliance, which has been up and running in our area for quite a number of years now. So I sit on the compact with that hat on, as well as my Warwickshire County Council hat on, and where there are opportunities, particularly around supporting the needs of individual practitioners and organisations who want to develop in that area or are looking to expand their knowledge in that area, that's probably where I would see the role for the Warwick District Compact.
Warwick district is quite a small area. It only encompasses sort of 3 or 4 towns, so Warwick, Leamington, Kenilworth and Whitnash. So as a percentage of the county as a whole, it's quite a small area, but it's quite dynamic, quite creative. We've got quite a number of creative businesses, so it has the potential for leadership, to sort of be that flagship and showing how creatives can get involved in either economic development or creative health.
Fantastic. And I think, what we're beginning to hear is, I can't remember who said we've got to celebrate a bit more what we're doing. I think you're saying, Helen, we don't often have an opportunity to stop because there's always the next mountain to climb, isn't there? So there is that. But also it just feels like a good point in time where this is all about the sum of the parts. And actually each of the parts are very fragmented and poor of resource, so it's very difficult to get together in a position where people can collectively give because everybody's in a different place, whichever sector you're in. So I think this is an opportunity today to really be really honest, and I think it's helpful that you've just been really honest there. These are the problems as well. So isn't it amazing how far these compacts have got? We're beginning to even understand what might a compact be, which is a miracle, and what next, and what could we talk about today that could sort of overcome some of the barriers that we're probably feeling day to day. We've got a bit of headspace today to think that through. So, and a little bit back to Walsall then. Is that right, with the health perspective?
So I'm Helen Billings, Head of Partnerships and Development. So I have an NHS email address but sit in a place-based partnership organisation. So I think what I can probably add to the panel is an understanding of how health works or doesn't, and the interconnections between different health partners. So GPs are very different to people in hospitals, are very different to mental health. I also have quite a lot of close links with the third sector, Vicky, one of my colleagues, social housing and the council, both in terms of public health and some of the regeneration people. So either on camera or off camera, you can ask me questions about how that might work. If there are unfathomable, bonkers things that are going on in your part of the world from a health point of view, I might be able to say, it could be this, or have you tried that? And I'm happy to be that resource to all of you in the room. And I do have some understanding of how statutory commissioning works. You and I have had a conversation about that. And actually, my impression is that sometimes people with a creative background or who haven't been grounded in the NHS kind of don't always understand it and assume it's this, and they may get told it's this, but actually really it's that. So that's my little word of wisdom. One of the many lovely things I do in my job is work closely with social prescribers. So I imagine a lot of you would understand how they work and how they operate. If you don't, you can ask me a question about how it works in our part of the world and how that might link ultimately with some of the work around creativity and health. I think one of the things we do really well in Walsall is make stuff happen and do stuff differently, and I imagine that kind of approach would be similar across all of the cultural compacts, but we might have some quirky little things that we can add to the mix. What I would say is, hearing about your Walsall is diverse, and there's areas of diversity for all of you. I think the poverty, we haven't heard anything in the audience from Birmingham. I think second only to Birmingham in terms of the poverty and the cost of living crisis and the impacts that that's having on people is so huge. To keep that effort and energy on things like the opportunities and the community assets is really, really important. And then I would say, how did I get involved? Vicky asked me. and I said yes. But sometimes it is, isn't it? It's about relationships, and it's about the people who will turn up, will put a bit of discretionary effort in. So she asked me, and I have to say the first couple of meetings I thought, this is not my room, this is not my people. Because the conversations are so much about regeneration, and I kind of thought, but that's not me. And I thought, well, come on, Helen, put your big girl pants on. And so I thought, well, what would I like? I would like a conversation about the health and the well-being, widest, not just doctoring health, widest well-being opportunities, but also about those people who are furthest away, who are invisible, who are hidden. And so those are the things that interested me. So you gave me a platform, didn't you, Vicky?
I did.
And I bossed it. And so now I think we're still in the forming stage, because as Vicky said, we haven't nailed down our strategy and our priority. However, from the outset, there will be quite a lot of challenge from me of colleagues who want it to be entirely around regeneration and income, which is fine, that's their thing. My thing is different, and I can push back against some of that from the outset. And it's almost like having that, the weight of the NHS gives me a level of authority to be able to challenge some of that thinking. So I'm slightly different probably in my background to some of the other people, and like I say, the really good stuff I'm not going to say on camera.
Brilliant. And we've got a great spectrum of experiences here and backgrounds, and I mean it's interesting, isn't it, because we talked about cultural compacts being about economic regeneration, place, and that is all well-being, isn't it? That underpins it. And so maybe when we start using the terms health and health services and social care, but actually this is all about well-being, and this is an opportunity. One of the conversations we had in this room around the network we had a little while ago was when we stop talking about this as being a group of people that want to help people out there and start realising this is about us and our communities and our people and our well-being, then it turns around. And I mean, I've just come out of a formal leadership role in the NHS around here, and it's great not to be in it anymore. Oh no, I did say that out loud. Edit. But what you're seeing here is relational leadership. This is what everyone's talking about, and actually we can cut through some of this frustration. So it's over to you. There were a few sort of ideas of questions here that Jane's very helpfully given us, just while you put your thinking hats on. So what areas of work are people particularly proud of if they're working with their cultural compacts? We've heard some of that now already, but some of you might have some questions about the work you're doing and whether that can connect in and whether the cultural compact could be of value. The current state of evolution of cultural compacts, so what is the potential future for them? And I think, as Claire says, sometimes when things do sort of fall apart, that is the opportunity to regroup and just do things differently, because carrying on as we are isn't going to work, is it? And how can the link between health and care, and again I'm happy to bring my perspective to that, but really helpful having Helen here, because it's in, we're in a new health and care system. It's all very well saying this is great, we've got integrated care systems, but they're another new thing. I mean, I think it's my fourth version and I'm still really young, so it's complicated to navigate. So over to you guys. It would be great if you could come up with some really testing questions for the panel. No, what would you like to discuss? What would be helpful? You must have come here today thinking, I might find out about this, that, or. So who wants to start? Yeah, Paul.
It's really interesting hearing all of your different perspectives and how you've kind of come to this work. I just wondered what the balance between long-term and short-term thinking, planning, actions are. At the moment, it feels like we're being pushed more and more to can we get through this month, week, day? But it feels like also we need to do some really kind of big thinking about 5 years, 10 years, 20 years down the line. So I just wondered how people are finding the balance between the short-term immediate crisis and the long-term thinking.
Anyone want to kick off with that?
Shall I just say something?
Yeah, please do.
Just because I feel like I did an introduction before but didn't talk about the compact
as deeply as I wanted to.
Our compact is also, so it is going to connect to your shorter long term. Our compact has the City Council as part of it. They come along, they participate, but we are independent as well. It's set up as a CIC. We're thinking about changing that to a CIO, just because that feels like it's better suited to where we're going to go. Like Hereford, Stoke was bidding to be City of Culture, and that's where it came from. That this ambition to be able to bring in that sector leadership voice. But also we know in a place like Stoke, which 95 in Stoke and Newcastle together, there is 95,000 households that are living with one or more deprivation, marker, and that's our artists. That's where I come from. They're my friends. They're my community. Like we were saying before, how can we make a positive change through the compact by all working together, but also working holistically across all sectors, because everybody starts to go, it's about economics or it's about health. Well, people don't work like that, do we? We're not sectioning this part about my well-being. I'm not sectioning tomorrow about being my financial health. It's all happening all at once for all of us. It's just we're trying to section it off to make it more manageable. And we're about building infrastructure. So in terms of thinking about what does the long term look like for Stoke, it needs some infrastructure. It needs some people to have the skills and want to make and have leadership progression routes, to not feel like you're trapped by the circumstances of the fact that you actually want to work in a specific place. Perhaps that feels like I'm talking personally. I love Stoke, and I don't want to go and work in anywhere else to do the work that I do about making all of that positive change. But the opportunities for my progression are elsewhere, unfortunately. We said we would set up to be a place where additional investment was going to be. That's long term, isn't it? How do we be an investment ready proposal? How do we have the ideas? How do we have the investment track record? And how can we present ourselves to all of these new people who have never invested in Stoke-on-Trent and Newcastle-under-Lyme do it again? And I'm guessing that possibly resonates with the rest of the panel. So that's our long term. In the short term, we're creating things which are about, we've had some place partnership projects, which means we're developing a 3-year programme of cultural action zones in theme, not geography. We've got some UK SPF money. We've managed to have some volunteering money from Know Your Neighbourhood, and prior to that, as part of a Midlands collective, to do some volunteering for people who might be at risk of loneliness, to support the sector to see what a coordinated volunteer scheme, rather than us all finding people all of the time. If we just carry on doing that and then there's somebody finding it for everybody, what difference can that make? And we would have been doing that for 3 years soon. So I suppose there was always short-term action for your long-term gain, and I think what's great about being able to have a compact of colleagues who come together, you can all be spurring and go, what now? So we've ticked the long list of our long-term gain already. What do we do next? Where's the long term now? And that could look different for everybody. And actually Susan, who is the exec director at the moment, and we've got some paid resource as a team, that is really important to build that. She had us all do a drawing about what the future looked like. Mine was a tree with roots and mycelium and lots of different types of organisms living on it. Somebody drew that they want Stoke to be a place where could be considered and not the butt of the joke for Eurovision in the future. So there's a wide range of aspiration, but actually the thing that is how do we holistically make a difference, and how do we take people with us, whether that's the strategic people at the top, or whether that's people who are in our neighbourhoods, or it's our creatives. We have a Stoke Creates Exchange Forum, which is that non-hierarchical networking. So getting people together, sharing their ideas, connecting together, they're going on a net walk. But just that flat space to go, actually there are other people and they have a practice a bit like mine, and that has not been sustained before in a place like Stoke in the time that I've worked there. So I think I did two things at once then.
No, thank you. There's some great creative health language coming out. What was that, a net walk?
Yeah.
Like that. And what were the light ignite and what were the sparks? Spark ignite. You see, you can just, this is just not the language you get in quite a lot of settings when we're trying to be a bit creative. So anyone else want to add to, answer the question about short and long term?
I guess here in Shropshire it's still relatively early days, and so we're very much creating a foundation for the Cultural Compact. So our vision has always been relatively short term. And in many ways, that's essential to sow the seeds to demonstrate what culture can do and give the confidence to our immediate colleagues and also the grander hierarchy across the county, both in the private sector and also in local government, so not dissimilar to some of the aspects you're talking about. Helping them understand the benefits that culture can bring on all the different platforms we've talked about, whether it's economic development, health and well-being, the whole managing the demand on the health and well-being sectors. Once we can prove the benefit of culture, we hope that we can then grow their confidence in us, and who knows, funding may or may not come. The long-term future of all compacts, I think we do need to look at funding, and we've been told from our relationship manager there's unlikelihood to be any dedicated compact funding, and so look at project funding to support it. If anyone has any other advice, please let me know. But thanks to colleagues like Tim, who comes from a very different environment from us, but very much looking at strategic planning for large international companies, who's helping us to expand our vision and look further beyond the horizon and really start asking some quite challenging questions about what we do and how we do it. So although we're sort of focusing on the short term at the moment, I'd like to think with the direction of the board we'll be able to look to the further horizons. And without that, I think we would be doomed. We need to be looking at that in order to ensure the longevity of the compact.
And interestingly, quite a few people, possibly everybody's talked about this sort of start and stop and ebb and flow of compacts and the change. You know, they're not one thing, are they? So the fact that the compacting, maybe it's a verb, compacting is going on, that it sort of changes over time. But
I was going to say,
go on,
having Alice there, it usually is the way that you need somebody to do the stuff that makes it happen. And I think compacts and all sorts of other networks wane when there's nobody who gets all the stuff on their desk. So Herefordshire managed to get funding from Arts Council to have a coordinator, and their post just ended in March, and we're now fundraising to get somebody else, because stuff just doesn't happen. And I think capacity and this funny expectation from the powers that be that we can all just do stuff on top of our regular jobs, it's ridiculous. And so we have to kind of fight for that. And I hate seeing all the money going into admin when it could be going into the doing, and I really get that in deprived areas. That's also really bad, but you can't shy away from the fact that if there's a job to be done, someone has to get paid to do it. So that's currently where we're at. But another thing we do that helps us kind of think longer term is we also kind of own Herefordshire's cultural strategy. And we're just rewriting that. I think it was something like 2019 to 2029, but we're already redrafting it. And we managed to get some SPF money to help fund that and bring the council into that. And as part of that, they've commissioned a really interesting survey with some external consultants who are trying to put a value on culture in Herefordshire, which is really hard because most of the businesses are sole traders, and all the usual measurements for accessing where, like all the sort of government surveys, if you're a micro enterprise or smaller, you fall outside that. And interestingly, the consultants have used LinkedIn a lot and gone through people's profiles on LinkedIn and looked at where they're based. And we're getting a lot more data about how it's huge amount of work and wealth is generated by people in their spare bedroom being amazing. So,
Just picking up the point about sort of unless there's someone paid to do it, things don't happen. I naively set up the compact thinking all of the wonderful board directors would have plenty of time to lead on this project, and with a few exceptions, absolutely echo what you're saying. Unfortunately, people's capacity just doesn't allow it to happen. So it's reassuring it's not just us.
But just to add to that point, we're in year 6 or so, and we've gone from a compact of 15-20 members down to about a core of 6 or 8, and we just keep turning up and we keep doing it. And actually the fact that you've got a group of doers in the room who are prepared to give up some time, some run their own businesses, some like myself work for local authorities, so have kind of got paid time to be a bit more strategic. We keep going, and there's that sort of, because it's our patch and it's our people, there's the passion to make something happen. And we keep having conversations about actually we're still quite local authority driven because the ownership still sits within the district council. And we feel like we ought to be moving more similar to Stoke to sort of a more independent model. But while we've got 8 people in the room who are really up for doing stuff and are making stuff happen and making projects happen and applying for funding, we're just rolling with it. And I think for those of us working in the sector, you have to be nimble, you have to think on your feet, you have to kind of not follow the money but go a little bit where there's money or where there's sort of people willing to do something, and we just keep going. And we're still seeing projects develop and still seeing projects happen. So the whole, it ain't broke, don't fix it. At the moment, we're still seeing some momentum and we're still seeing some delivery. So we're deliberately not sitting back and saying, actually, oh no, we really ought to be independent. While we've got momentum and while we've got delivery, we'll carry on.
No, it's really helpful.
Again, just picking up on that point about independence, to me that's a really important question, and we're going through that debate at the moment, looking at whether we should sort of move away from Shropshire Council to create our own independent body. The board at the moment feels that is the direction, and we are now sort of a process of appointing a consultant to look at that in more detail to give us some informed advice. From a funding perspective, that would allow us to be independent, and so we wouldn't be restricted by some of the funds that only are open to the local authorities. But we're having the local authority embedded within the compact, we potentially would have that ability as well, so we'd have the best of both worlds. But again, if we're looking at the long term, I think that's something that as compacts we should be looking at as a specific issue, independent or sitting within a major institution.
Laura, sorry. No, go. Do you mind, Laura? Sorry, the mic is over there. Do introduce yourself.
Laura. Hi everyone, I'll stand up slightly. Some of you know me, I'm Rachel Marsden, I'm a researcher in creative health currently with the University of Birmingham Keele University, but I wear a lot of hats. I'm not going to stand here and explain that. I want to first of all say thank you for all the work that you're doing, just to remind you of that, because you're all doing brilliant things that involve a lot of pressures in different ways, but is moving the sector forward, so thank you. I want to come back to language, which has been mentioned, and the relationship between kind of creative language and the language of health, and trying to understand about your confidence or challenge of negotiating that space and creating a shared language as we're trying to come together more for mutual goals and aims and outcomes. So maybe just reflecting a little bit on how you might have negotiated that and your growing relationship with either arts, culture, heritage or the healthcare sector, because from my own understanding of sitting in those two areas, it can often be quite frictional, it can often be quite challenging, and certainly in the commissioning or funding stage. So Helen, when you were talking about understanding of commissioning within the NHS as well, it can feel very, very foreign and different coming from the arts, stepping into that space, and vice versa, also around evaluation too. So I'm just kind of wondering if there's some reflections that could help each other around that language.
I'm going to Helen, I was just going to say, because you just brought up the idea of not being in the right room, and I think we often feel that, don't we?
And so I needed to have you talk about leadership, that relational leadership, have the confidence to make it more of the room that I wanted, if that makes sense. So in terms of navigating the language, and I'm going to pull Vicky in a little bit as well, one of the things we've done in Warwick Together, so that's not the cultural part, but we're very active partners with the Cultural Compact, is come up with something called a wellbeing outcomes framework, which is positively framed, and we work with our third sector colleagues to help them articulate. We have helped people make connections. We have helped people improve their income. So if there's any public health people in the room, the kind of determinants of health is some jargon that they might be familiar with, but we've co-developed it with third sector colleagues and citizens. So we've got a shared language about well-being that's not jargony at all, is it? Yes. It's very real, and we're moving, and because we've done that with full oversight and engagement of our local authority and our NHS colleagues, it's kind of meeting in the middle a little bit. So that's helped give us a shared language, and also it builds in that. So I can own this, the NHS can be quite deficit oriented, fixing people who are broken. But actually having a well-being framing, it enables people who have an asset-based approach and a positive language to take part in the conversation. So that's kind of a very formal, and we are linking it to the way we measure outcomes more broadly and how we commission as well. So there are opportunities to start doing some things differently. Totally. What's your experience of that been, Vicky? Making it up?
No, not at all. And I think having Helen in the room is really helpful because she understands both sides of the fence, so she doesn't sound like somebody from the NHS. Sorry to colleagues in the room.
You can do the act.
She can do the act. So that's really helpful. And then us as an umbrella organisation supporting voluntary and community sector, actually trying to bring those people together to understand the different interface, really. Because I think sometimes the voluntary sector can think, well, that's not us, that's somebody else. So it's trying to bring all those sort of different voices to the table.
When you're in a context of the NHS undervaluing the voluntary sector as
exactly,
well.
Exactly.
And this is a huge opportunity to demystify.
Yeah. And dare I say, so we've got the integrated care systems, etc., which I'll tell you, it baffles me. But trying to make some headway, I suppose, really around how building up people's health and well-being, you know, how that can have a bearing really in terms of the work that we're doing at that integrated care level. So I think it's really trying to use this as an opportunity to change that thinking and change that direction of travel really around how people who probably commonly think in a medical way in a different way about how we can do these things. So
I was going to bring some others in a minute, but just check, Jane, I think one of the ambitions of today's conversation was to provide an opportunity to share things. So whether they are outcome frameworks, you were talking about the work that you're going to be hearing back on. I'm not suggesting that you're all going to want to share everything you do, but if there are things, then I would suggest that might be a really helpful outcome of this forum. And just hand that over to Jane to work out how to do that.
The stuff we've done, I sent a hyperlink, it's on our website, and our stuff tends to be very colourful and simple. You know, it's the visual that we've got actually has, if any of you know Walsall, there's some of the things in there that are very Walsall-y. You know, there's a statue of a miner and things like that.
Anyone else like to come in on this one?
When you were talking, I was reminded of when I was at university randomly, and it's a surprise I was even there. But there was a takeaway around the corner, just coming to language and takeaway around the corner, and I was there for 3 years, and I would only ever go on my own because I wasn't sure. They had 2 counters, which one I should stand at to order my food. And I think, you know, my children then started school. You know, I had children and I went to the hospital. They looked after me loads, but there is an expectation that you've already been there and you know how it all works, whereas I didn't, and I was a bit terrified to ask any questions. The same when my kids started school. People who work in education expect you to know how education works, and I think sometimes arts and culture does, like people are scared, am I supposed to wear my best suit to the theatre, or am I okay to have I got to go with a group of friends, or can I go on my own? Who's there who's going to expect me? Are they going to think if I say something that it's going to sound stupid? And all that happens, doesn't it? And I think remembering that people, you might say one thing and it needs to be translated for another is sort of what I was hearing, and that's, you know, for people are experiencing all of this stuff that we're doing for the first time. So how do we make that easier for them and for each other to be able to get the best outcomes for everyone without... And there's something a little bit about speed of the way that some of the organisations work. Creative and cultural organisations are quite often, particularly in my area, chronically under-resourced. You know, an individual artist is just trying to survive and wants to work in all of these different ways because they know that their practice is good, but they can't wait for somebody to tell them how to get that job to do the work that they're really good at. So then they may have moved on and missed that opportunity. I think our jobs as people who want to make a positive difference is how do you make that, the speed and the language more accessible for everybody. And there's something about My friend works at the Midlands. She might tell me off for saying this, but she's a people person in the Midlands Combined Healthcare, I think. And they were going to commission somebody else to do a project outside of the area. Looked like an amazing project. Somehow she just sent it to me. She thought of me. I must have been texting her about something else. and she sent it to me, and I just went back and went, it looks good value. It looks like it costs, and it looked like it'll have good outcomes. And then she said, the New Vic Borderlines team have done projects like that in the past, and we've worked with them. There's something about horizon scanning, isn't there? So if you're in health or you're in education, doing that, who is local, who could do this work for us? And maybe the compact, by trying to be hyper-connected across sectors, could do some of that horizon scanning for somebody, providing the opportunities. And there's something about the evaluation and demonstration of abilities, and the language mismatching, because in one moment you're trying to showcase that you're doing what you told Arts Council you were going to do with all of that money in their language, and then in another language you're trying to skew that message into what somebody else wants you to tell them in their language. It can feel quite schizophrenic as somebody who's doing that.
But Paul, did you just want to come in on that?
So really just building on that point, it's fascinating to hear sort of the complexity we have with the language, but it was brought to me that if we can't cope with it, how is the end user, the consumer, the resident actually going to cope with this? And it was brought to me when we went on a needs analysis meeting where we consulted with the local community about how they view healthcare wellbeing services. And in their mind, when it was, how do you view healthcare? I can't get an appointment at the doctor. That was their only concern. That's how they viewed health and wellbeing. So how we can expect people to navigate the work that we're doing? Where do you start searching for support? Where do you start searching for help if we don't use a language that's accessible by everybody?
And wouldn't it be great if the marker of the success of creative health was the fact that people felt having a dose of creativity was more important than an appointment with their GP?
Just on the evaluation, it was a really good question. I don't have any answers, but one of my friends who got me into this whole thing is a GP, and she's an unusual GP because she got a joint honours in medicine and fine art, and she's also, I know, and she also illustrates children's books in her free time.
She has free time.
And she worked for years in Tower Hamlets in London, and she moved to Herefordshire with her husband when they wanted their kids to have more of a rural childhood. And she was like, oh my God, compared to Tower Hamlets, Herefordshire has no data on social prescribing. We've got no idea. Well, there's hardly any anyway, but even if there was, what difference is it making? Where are these? Is it helping? Where are these people going? Is there a chain? And she's like, I'm just amazed by the desert of any sort of evaluation in this area compared to my working background in London. And I thought that was really, really interesting, because wherever there's a problem, there's an opportunity, and there could be something really interesting there for all of us.
Yeah, and Tower Hamlets was so ahead of the game with creative health and social prescribing, so that is interesting. Laura.
Extremely interesting.
We've all got verbal diarrhea.
My question's getting bigger and bigger than we talk as well. But, so my name's Laura Attio. I'm director of Open Harmony CIC. We're all about music for mental health and wellbeing. We're a social prescription intervention. I've been going about 5 years. And we're about enjoying music. So the mental health benefits come through absolute involvement in music and the community that we've built. We're open to all, and we like to think of us as a very diverse, inclusive community that is a kind of microcosm of the wider community, but it's somewhere safe where people can unmask, be themselves, and just have fun. And we have online interventions as well. We have online services as well to really bring in people from all over the counties, and we cover Telford as well as Shropshire. My question is about investment and the synergies between business, health, the arts. I was intrigued by what you were saying, Emma, about the creative quarter. With another hat on, I'm a social enterprise lead covering Shropshire and sit on the BCSE board. And
what's VCSE?
Voluntary communities, a social enterprise, etc. So there are such things as SE places, so social enterprise places. Bristol is a brilliant example. Greater Manchester is a thriving SE place. It's a kind of accredited sort of status for a county or an area, and they can bring in millions and millions of pounds of investment. And it was sort of sparked off by what all of you have been talking about, the synergies, and it's not just a sort of sector-based thing. The dream for me would be to bring together the arts with social enterprise, with business, and the health impact together in one massive, impactful thing. It's a nebulous question, I realise. I was just intrigued by what you were saying, Emma. How's that working? Can you show an impact together with all these sectors, or has anyone else got any bright ideas about how we progress this?
It's a really good point in that we think about public sector, our communities, we've got deprivation, but actually there's the rest of the world, isn't there? There's businesses, there's social businesses, there's the rest of the businesses with their CSF and requirements and things. So yeah, any examples of where it's working?
Just to follow that, the original idea for the Cultural Quarter in Leamington came very much from the District Council because they'd got a number of vacant properties. The district itself, as I've said, has got quite a number of creative organisations there. They've also, Leamington Spa is often known as Digital Spa because we've got a huge number of creative digital gaming industries that actually bring in quite a lot of employment into the area. They bring a lot of money into the area. So I think the District Council is very aware of that. And in terms of kind of looking at employment, because they're big employers in the area, we've got a couple of colleges in the area that are very active in terms of really supporting the creative industries because they can see that those routes, those talent routes into those creative businesses. So I'm going to say it nice and kind. They can see the economic impact of that. So in the nicest possible way, they do support arts and creativity there, but they can see the business and economic outputs of that. So there's a combination of sort of derelict buildings, an area of the town that it doesn't feature on the deprivation index, but in terms of the sort of visibility of the town, it required that kind of investment and that improvement in that area. And then you've got big employers, growing employers in the area that require that creative, that arts talent. So the combination of those together made it a no-brainer, really. They needed to look at how they looked at certain areas of the town and how they thought they could bring that kind of collective creative expertise together to give that little bit of oomph. So there was no, Jonathan from the district would be able to answer that question much better than me, but certainly that was where that development came from.
So it's a really good example that we're often chewing over with stuff. Why doesn't the NHS get the value of creative health more? It's leaning into the needs and wants of the different sectors. So you've got to be solving other people's problems. So if we can come together as a cultural compact to solve the problems of the members, then we're going to get more, despite the capacity issues and resource issues. That's really helpful. I think we're moving over there now, aren't we? Yeah. So just, if you've got these, if you don't mind passing the mic. And then we'll come to Tim, and I hope I'm next in people.
Thank you very much. My name's Annabelle Gittins. I'm a Library Support Manager for Shropshire Libraries, and I've been involved in I can't even remember what it was called now, the CCS many years ago in Shropshire, so the Culture Consortium. And my question is around sort of picking up on the language as well, but also developing it into the data. I've dipped my toe into creative health with the local team here, and I'm afraid it was only a dip of the toe because we struggled with understanding each other's language. So I know we've already covered that, but what we understood as asthma nurses were not what they understood as asthma nurses, so that was a really big sort of area that we fell down. But the next one was data sharing, and I know we cannot know any personal data, obviously, but not even to the extent of knowing where to focus the activity. And I just wondered if any of you have come across that or found a way of overcoming it, because without, when you're dealing across the whole county, there's no point trying to
Was this around the scene for breathing?
No, it was for children. It was more for children.
It was the children's social prescribing and asthma. Yeah. So that's a really good question. So I should think there might be. Yeah. Do you want to start?
So what I would say is, and I'm going to have to try and put my tactful filter on.
No.
So in the NHS and to a similar extent in the council, there is a nervousness and anxiety because of some of the headlines and some of the red tops around so-and-so left their laptop on the train and blah, 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 blah. So there is a natural risk aversion in people who work in IT and work in information governance, and you have to have a certain mindset. And what can happen is, even with really helpful, sensible legal data sharing, it becomes more complicated than, in my view, it needs to. In those situations, what I have done, and again off camera I can say, is I kind of try and articulate the risk of not sharing the data in a very real and accessible way. So if we share this data, there is a risk, which is 1% risk, that something might happen that will give us a bad reputation as an organisation. Yeah, that's fine. However, if we don't share this risk, there is a 5% chance that children with asthma won't get access to the help that they need. So actually countering the risk aversion and articulating the counter risk is the way that I would typically approach that. Have I been too obtuse? Does that make sense? No, and if you are, again, you have a tame NHS person who's used to having those conversations, and I imagine it's similar for you as well. I could help, and there are people like me, I imagine, local to you, who could help say, and this is the clinical risk of not doing it, this is the risk across the place of not doing it, and this is the benefit of doing it well, and you can kind of get around it sometimes if it is genuinely anonymised data. And also the other trick, the neat trick, is permission. So if somebody gives you permission to share, it doesn't matter. It does matter. You still need to do it sensibly, but that's another way round if you build in agreements.
Can I just say one thing on the back of what Helen's just said? I've recently been doing a lot of work with public and patient involvement groups, so PPI groups, and one thing that has come through quite consistently across all of them is the fact that many of them don't feel that their medical records or the data that sits behind the scenes about them represents who they are. So there's something there as well about incomplete stories. So even though the data does exist, does that data actually give you a full picture of that participant, of that citizen experience? And it's something that has changed the way I think about research because of that, because of that very honest articulation about them not feeling represented in the NHS data, in their GP data, that they're trying to make public and accessible for use in different ways.
And I think also when you're looking at inequalities, digital poverty and those people furthest away from services have a whole raft of extra lack of trust in what we do with their data. And it's some interesting research about that too.
And I think the other thing, social prescribing, when it appeared, I sort of almost groaned, because why make the non-clinical stuff sound clinical and medical? But social prescribing is something the health service understands, is funding, and is there. So there's something positive there. But, a really good example of ridiculousness is where initially the social prescribing outputs, well, they were outputs, outcomes were measured as the number of referrals GPs made. Well, didn't even mean anyone went for their social prescribing, and the number of link workers employed. So we've also got this shared leadership between creatives, all the different sectors, the NHS. It's a whole evolving, a new language and a new way of shared leadership that will work itself out if we can just have those conversations and as you say, and explore them. And something about almost mutual advocacy, isn't there, for the common aim? Brilliant. I think Tim now, and then...
Can I just ask, with the question, were you looking at more through the the broadest priorities of the health service locally in terms of where where we can add value to their work. We talked a lot about the individual cases and some of the data that lies behind there. So I have to say I struggled in the first instance to find out at a broad level where we as the creative industries could support
That's exactly, we were just looking at where we could run some activity that would have the most benefit.
It was only until I had a guide like Jane who was able to put it in my language, right, these are the priorities that we want. So this was with our funding applications, is when you kindly said, right, these are the areas we should be focusing attention on. That was revelation. That was the first time I was able to get to that level of detail.
So for most areas, again, I might be singing to the choir, but there's a joint strategic needs assessment that sits in the council, and that's language that's universal across the country, and they have lots of data about demographic data and needs and etc. So and often there are things like fingertip searches, and you can drill down. So if you're wanting population data, a lot more of it is nationally freely available than you might imagine.
But I think you're absolutely right. So there is a function there of navigating, and certainly a lot of, say, the person-centred teams, so Penny and Naomi locally.
I was working with Naomi, just as frustrating.
Just as frustrating, yeah. And that there you've got the sort of gap between the local authority data and analytical folk trying to understand the NHS, and I think that is just work in progress, because funnily enough ICSs are not working as they're intended to yet.
I always try to think of almost like a persona of a single practitioner working in rural Shropshire. They're a potter, they're also the financial director, the CEO, the operations director, they're everything. When someone says, well, how can you support the creative health agenda, where do they start with? Someone says, what can you do to support people with lung issues? Suddenly it's a very different proposition. So it's trying to give them that very fundamental direction. This is where we're looking to grow support.
Yeah. No, really helpful.
There was also in the Arts Council, in their wisdom, ended the contract and gave it to PricewaterhouseCoopers, who know bugger all about the arts. But before that happens, there was the Audience Agency, and they were really brilliant, and they still exist, and they morphed and survived. But when, for the decade that we all had to provide our audience data to the Audience Agency, they have, by region, and the most amazingly detailed data on audiences, which is essentially who you're trying to reach. So there might be a way of getting that information from the arts side, not necessarily the health side.
So with the Audience Agency, we buy an audience profile report, but also it is available on the Office for National Statistics, and it breaks it down on ward. And I ask not just for audience segment, I ask if it can be like the mosaic and other things, and that's why I know there's 95,000 households who are living with one or more deprived, and it tells you people who've got a disability, people who live with long-term health conditions, and the number of people and the percentage of people who are in those areas on a ward by ward basis. So that would be your place to start. But I would say data is just the start. I would use that data, and then I'd go and have a walk around, and then I would go and talk to some people who work there already, and then the snowball goes.
And I think most ICSs, all ICSs are now restructuring, because we've just got to do that, obviously. And I think the data and analytics and population health function of ICSs isn't where it needs to be anywhere, and is growing. So it's, these are the questions that hopefully there'll be sort of more ways of, and the PCN data, primary care network data as well. That should be really helpful, but at the moment it's not always.
And also I was interested around, you talking about social prescribing in our area. No matter how many times we try and find a link worker and we know that it's housed somewhere, it's absolutely impossible. So to meet you two today, you could probably tell me if the social prescribing in the area is happening to arts and culture, and by how much. It would be really great to know that, to know where you're starting from. Because and who else they're social prescribing into, so that you can see where the partnerships could be formed. Not just for the people who this compact are supporting. That would be great information for the rest of the NPOs and the independent organisations that you're working with. It feels like it feels a bit trickly, and it feels like you might have some of the magic.
There's a sort of navigating how to navigate.
Well, even just getting a reply. Hey, we would like to talk to you about how social prescribing has worked. We've got these offers. We've got funding for loneliness, all this kind of stuff. And
I think today will spark off quite another lot of conversation. What I'm going to suggest is, so that we have got a little bit of time for people to sort of zoom in on the people they want to speak to or whatever. Tim, perhaps if you'd like to ask your question, and then we'll wrap up.
Tim Russell, I'm part of the Shropshire Cultural Compact. The longer I'm waiting, the more questions I've got.
That's my fault for facilitating poorly.
The first one is observation. I don't know who it's attributed to. I thought it was Einstein. What counts in life can't always be counted. And that's one I think we're up against. I've actually written a book on evaluation, which I'm happy to discuss with people if they want to. Available in all good bookshops. My first question is, I think I know the answer to, because you're so caring and sharing. Warwick and Hereford seem to be having some consultancy research. Can we see those when they're done? Can it be published?
Yeah, I don't see why not. Yeah.
Good. My second point is, I guess, something which we're all concerned about. The need for what we're doing, I don't think has ever been greater than it is at the moment. The money to achieve it has never been less. And it sounds like we're all at the moment pretty much dependent upon SPFs and art councils and all the rest of it, which could, dry up. Now, I'm also associated in London with the City of London Cultural Compact, and they wouldn't have a clue what you lot are talking about. They have what they call the Cultural Mile. If you know the City of London, it runs from Smithfield Market, which is going to be the Museum of London. It has the Barbican Centre, it has the Guildhall School of Music and Dance. And the Cultural Mile is actually run by a bid by a business improvement district, and this year their annual budget is £1.8 million. Now, they see it, Cultural Compact, as entirely commercial. It's about regenerating commerce within the city. It's about a nighttime economy. So I guess my question to us here is, will there be a stage for what we're doing to be commercialised? Can it cope with being commercialised? Where does commercialisation fit? This is very much, I think, building on some of Laura's points as well. So maybe if we could sort of just talk about the commercialisation, possible commercialisation.
I've got something to say.
Yeah, please do.
Which is like,
my name's Nikki Holmes. I have a background in arts and health. I was one of the practitioners on the first Arts on Prescription after the Morton Clinic all those years ago for HIV. I've been out of arts and health for a while, so this is sort of me coming back in and hitting the ground with a thud, I think. A lot of it has changed, the terminology, certainly, but the problems are all the same, actually. With focusing on the money, as you said, some of the things that are important can't be counted. And it kind of, in chasing bringing cash in, certainly to, say, a town like Shrewsbury with cultural events, nighttime economy, blah, 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 kind of misses some of joined up thinking about the people that actually live here and the demography of the people that live here and the state of health and well-being of the people that live here. And that needs to be supported because healthy and happy people are more engaged in their community, in the cultural life, and they are more productive. And we are in a position, certainly in Shrewsbury, where there's not a lot of young, healthy people to actually service all of this growth that you're looking to provide. So we need to be looking at ways in which creatively, through creative health, you can re-engage and reinvigorate and add vibrancy to your population so that they feel like they can be engaged in and part of and pushing in the same direction as these visions. And I think that's the thing that, to me, sounds like really needs pulling together. And it would be interesting to see whether that resonates with you as a group and how you can mobilise your population and the myriad of creative practitioners that are within county to actually support those ends.
So you've got commercialisation and you've got there this sort of tapping the potential of our people and our young people and the talent pipeline.
And our older people.
And our older people.
There's actually, I count myself as among them, there are a lot of London escapees in the county, or people that have worked in other great cities around the place who've got professional experience, who've got skills and talents. And we should be drawing on that resource.
And unleashing the potential of our people to grow creative health for... Because it is a collective, it's not about one set of people doing for others, is it?
And actually the way that even within people with who are socially excluded or economically and educationally excluded, the way that creativity, access to and involvement in creative outlets gives them a voice, gives them an expression, gives them an opportunity to stand to one side of themselves and look at potential they have that they may not have realised as well. And particularly around things, but you know, at the moment we've got a lot of people that are long-term sick. That sickness is sometimes exacerbated by their mental health and their feeling of being not capable of doing stuff anymore because they're not capable of doing the things they've done before. Being involved in a creative organisation or a creative project for those people within their community or in their healthcare setting can just shake the kaleidoscope and give them a new perspective on themselves, which can then enable them to feel confident to re-engage with life in general, re-enter the workplace. And I think we're missing a trick if we don't use it as leverage for that.
Thank you. So both those questions, do one or two of you like to come in?
I thought, Tim, your point was really, really interesting. I think, so City of London Cultural Compact, does that mean it's run by a sort of city council?
It's run by the BID. And one of the features of the City of London is that the square mile, as you know, is unique.
Yeah.
It's probably the richest part of the country.
Yeah.
And it's got a population of virtually nothing. So it's run entirely by businesses. And they look at it totally from a business point of view.
But the arts organisations you mentioned are also, compared to us lots, so rich, you know, and they have a box office. So
Barton's going broke.
Okay, but they can say, you know, we get X amount of footfall and we charge an average of Y per ticket.
Yeah.
Meadow Arts, we put art in the public realm. Everything we do is free.
Yeah.
So it's much harder to be economically valued. And this is part of the Herefordshire survey about trying to value culture. It's much less binary than City of London. So probably they're really commercially focused because the numbers are like zinging in their pupils in a way that I would find dreamy, but it's not going to happen. Yeah. So there's something about working in this area where you have to offer a lot of arts and culture free at the point of take up. Yeah. There's then a very interesting discussion about quality and what is quality, and then there's a whole other discussion about, but what do our audiences want? And I think that's a very interesting thing that we haven't touched on with social prescribing. How do I, as an arts charity, know what to offer? Because I'm not aware of any information about what's being asked. So do I just put it out there and hope that some people go for it? Or do I need to be much more calculating? And I think we need to have more of those sort of conversations as well.
There is a middle course in financing, which is to put on events which are free, but get people to sponsor them and put their labels over everything.
Yeah.
If a compact were to say we're going to go commercial, then that opens up all sorts of opportunities. And I'm very interested in what you're doing in Warwick. I want to find out a lot more about Warwick because I think you're going down the route that I'm thinking of.
I mean, just to come back, it's a complex ecosystem, and all of us that sit on the compact come with so we sit with the Business Improvement District, who obviously have paid members and have sort of outputs that they have to meet. I come from a sort of an arts and heritage, a proper old-fashioned arts development background. We have a range of different organisations who are all coming at it very differently. And I think that there is room for all of it to grow incrementally. There isn't the funding there to completely focus commercially, and then there is an understanding that actually we operate in some of our patches at quite small sort of neighbourhood level. So we try and understand the needs of those individual neighbourhoods, what the needs of those communities are, and provide as best we can the products and the services that we think best meet their needs, in the hope that there is take-up and there it grows, and hopefully over time it becomes sustainable, which is, that we're all ultimately hoping for all of our work to become sustainable. But it's that complex picture. We need the big cultural quarter to develop, to hook in the big investors, to bring in a little bit of money, to give culture a little bit of a flagship that our members, our politicians can get behind, because, yes, we're doing a cultural quarter, but at the same time we're doing the much smaller scale community development work with individual organisations or communities that have those benefits. And for those of us that sit on the compact, hopefully we've got that reasonable overview of all of those different things going on in that area, and we're nudging them all forward and supporting them in the best way that we can. But it's on quite a small patch. It's not across the whole county. It's across a small district, which actually is much easier to understand. And actually the way that the compact is seems to be moving at the moment is we're going from a Warwick district compact actually to almost a town compact, so working in Leamington town, Warwick town, Kenilworth town, because actually it's much easier to sort of get people's understanding and investment behind those smaller patches, because they can understand the impact it can have for them on their patch. And actually somebody living in Leamington wouldn't necessarily go to Kenilworth, which is literally 3 miles down the road, because it's got a completely different ecosystem. It's got a different makeup. People take their culture, take what they're doing in a not completely different way, but in a slightly different way. So you can actually have more meaningful impact in those smaller areas. But yeah, there's room for everything, but it requires that sort of complex ecosystem to support each other in a slightly different way.
Just to say, if this is about health and creative health, I would say going up front with a commercial language and a commercial sell wouldn't necessarily land well, just because. Now, I don't think finance and money is a dirty word. However, just a word to the wise. What I think is really helpful is for people across sectors to develop shared language, but principles, outcomes. This is what we want to do for our borough. This is what we want to do for our county. So I would say the language of values and outcomes is really helpful. And then just a practical point, it's about making things free. Just because it's free doesn't mean it's inclusive. There are lots of free events that Helen would turn up to because she's middle class, she's got a car, and she's got time off, and she's got agency. And some of the poorer Bangladeshi women who live in parts of Plek in Walsall would never think it's for them, even if it's an exhibition of art from South Asian of people of South Asian heritage. So we need to be really clear. And again, someone like me, you say, "Oh, we're making it free." That doesn't mean it's inclusive. So make sure you have that in your mind if you're talking to someone like me.
It's free to get in, but £5 for the car park.
So there are lots of barriers, aren't there? And if I'm trying to reach the furthest away from services, and you're offering me that bridge, then actually it needs to be hyper-local. It needs to be more than just free.
Just on that, and about the driving a new lingua franca for all of these things in a way is, which is actually a bit exclusionary saying that in itself, finding a language we can all understand. We've got the sort of professional cultural silos that we're having to break across in this sort of collaborative way of working. But when it works well, creative industries are very good at translating and enabling one another to come common understanding, and actually being able to bring together communities that feel excluded with perhaps communities that they might aspire to certain aspects of as well, or for people to just sort of break down some barriers. And I think that's one of the things that you can't leap from one to the next. You have to kind of lay the groundwork for those things. But I think, again, in terms of cohesion within a town and being able to make it so that all of your community are engaged in wanting to enrich their own lives and benefit the growth in vibrancy, and alongside that the prosperity of where they live. Again, I think using health as a route to get in there, it's almost like, having come from a background in arts and health, it's very difficult for me to see where the two things sort of slide out of one another. Many arts practitioners do it as a sense of they're driven by wanting social justice or wanting to draw attention to sustainability or issues around health or political agenda or what have you, and all of these things come together in wanting to promote people's well-being. And I think, and that's even with, sometimes, as you said, the greenbacks and the money can be seen as being an antithesis to that, but actually we need that prosperity to get any of this happening.
And I think that's perhaps also the opportunity that at the moment it's not as clear as we'd like it to be, as to how creative health can be a greater part of enabling our and our community's health and well-being. But we're hearing some fantastic things going on that are working in that direction. And I think also the other thing, this idea of talking about help, we start thinking about health services rather than that much broader wellbeing agenda, which is where we've been focusing on. So I think there's a long way to go. I just wanted to check, is there anyone that hasn't had an opportunity to say anything or ask anything, want to, just any final thoughts?
It's a quick question. I was just wondering, we're talking about accessibility, making services more inclusive. I was wondering,
do you want to introduce yourself?
Yeah, of course. Yeah, so my name's Nia. I'm a community mental health worker, and I also research the social determinants of mental health and creative mental health practices. So I was just wondering where co-design and sort of co-participation came into, specifically like your work, especially as more higher up rather than like grassroots work where co-design is maybe more prevalent. Where does that facet into it, or does it?
I would so like to ask that of the Integrated Care Board. That's such a good question.
Can I begin?
Yes, well, we'll go around. You're making a really good point, that actually nobody disagrees that working with people to understand what they need and want to meeting that need should be what we're doing, and it doesn't feel like that's the way strategically things are happening. So, any good examples? Or any, because I think you're talking about sort of doing the grassroots work, and how can we encourage more co-production strategically?
So Stoke Creates Commission is the landing platform for investment, and then it has a small team, but that's not a delivery team. It's working with other organisations to deliver that work, and that's where that happens. Stoke has got a really rich history for participatory arts practice, and there was when Appetite was set up originally for 2013, the additionality was that actually communities weren't going to make the art, they were going to make decisions about what art and culture was going to happen on their doorstep. So that's what we've been doing, and lots of other organisations in that area are doing that all of the time now through their participatory practice. So by commissioning the work out to the people who do that really well, and then them feeding back the work, the money hopefully will land additionally to the stuff that people could apply for themselves, and then it's already being co-designed because it's a tree, because it's all feeding each other, drawing up, bringing down, spreading out, all that kind of stuff. I would just say about the commercial, the additionality, and I think that's why the compacts are so different. We're reacting to place, and we have said, lots of organisations are looking for sponsorship in places like ours. It doesn't really exist unless it's one-offs. But that we were in City of Culture when we were bidding for that. We were told that there was lots of helicopters with money in waiting to land, and that's where this analogy came from. But I think in truth, the helicopters are already all being built. So the helicopters are being built ready to take off and then perhaps land through philanthropy. We've been trying that, and the same. With the work that people are doing on the ground, it's all being built all of the time, and it's just about being connected to your local ecology to be able to know what the right thing or the best thing with all of the parameters to do next is.
And are there any other examples? So how can we make co-production the way that things happen cross-sector? How could cultural compacts enable that sort of culture of co-production? Because there's so many good examples, particularly in mental health. There are some health and care organisations, there are many other sectors where it's done well, but it doesn't feel like in our health and care systems that co-production is utilised as much as it could be. And we won't become political, but you can understand why that's the case. How could cultural compacts promote co-production, and any examples of where you feel you're moving up that ladder of co-production?
So I've got a couple of ideas. One of the things that we do in our partnership, when we have partnership projects, we have an expectation that there has been some meaningful citizen voice in that. Now, it doesn't always mean co-production, if that makes sense, but it's more meaningful if it's a survey that, that it has to be a conversation. I think, looping back to the evidence, about half an hour ago we were talking about evidence, I think there's something really good about, some really good examples in qualitative research. And we talked about, we love peer researchers, so people who are of and from a community, having the skills and the agency and the support to find out from their own community. So there's no filtering from an outsider, no clipboard there, metaphorical or real, to get the view of that person. And there's something about a peer researcher model that kind of works better in an ICS. So there's something about it sounds sciencey and it's research, and even calling it qualitative research rather than citizen stories, it just seems to work better. So I think we've had some small successes with peer researching as a model, qualitative research, and also framing it in that way with some of our senior strategists.
Yes.
So I just got one question. I'm from the Alzheimer's Society. I'm the lead service designer. And sorry, I'm probably loud enough without. Oh, brilliant. So I think what I just wanted to ask is, because I've only just heard of these, not creativity and health, because we're very reliant on that from an Alzheimer's perspective. Nobody wants to own dementia. Nobody wants to, whether health or social care, either resources or just not having any clear pathways. So historically and currently we're still very reliant on using creativity and arts to help support people living with dementia and their carers. So it's like, so we have local and national services. How could we work together? And I'm going to leave the question broad because I've got about 10 questions. So you can answer probably some of those within that, in terms of, we work a lot through partnerships. How could we work better together to be able to co-produce and then deliver services for health as well, and hopefully create some of those pathways.
And you're asking on behalf of Alzheimer's Society nationally, aren't you? This isn't just in one area necessarily.
We work nationally, but we also work locally. My team work on some very, very localised projects as well as, but we also then scale some of these approaches nationally that can then be tailored locally as well.
We've started a conversation, haven't we, in Walsall around dementia, and started bringing a number of voluntary and community organisations together to just start having a conversation about what does dementia look like in our local area, and how can they play a part, I suppose, really in the work. And we've started a conversation, haven't we, Helen, in bringing that together, and we'll continue that conversation with the voluntary and community sector, but be happy to continue to have a conversation with yourselves, actually.
And I would say that one of the things that's happening is one of our colleagues, who's a third sector worker, does a lot of work in black churches, is going to be hosting a table where we will be talking to people from the community about what's it like for you and what might be different. And the benefit of having a place-based partnership in Walsall that works most of the time is that we've actually got senior commissioners who will be part of that, and they'll hear the outputs. And in fact, we've got a meeting on Thursday, and this is what the community have said. Some of that's what Jessie's already mentioned, and this is how our commissioning intention. So we've kind of got some ways of bringing it together, haven't we?
Definitely.
I think it also goes back to what I said at the beginning about, sharing and being in these groups together. So in the Herefordshire Cultural Compact, one of the members is the Courtyard Arts Centre, which is the main arts centre for Herefordshire. And they've chosen to do a lot of work on becoming a dementia-friendly venue. They have, film screenings that are dementia-friendly and all sorts of things. So they bring that knowledge to the wider compact, and we then learn, and we can go to them if we want to start our own projects. So it's about having local examples and local places that you can call upon to wise up, I think. And that's the benefit of multiple partners, isn't it?
I think it's a good example of a question around the ecosystems that we've been talking ecosystem, and I know one of the models we were looking at was sort of solar systems, and how you, at every level, you've got the very strategic level, you've got people on the ground just wanting to play a part in it, and people with need, and how can cultural compacts over time sort of knit that ecosystem together, because they're not going to be the same, but wouldn't it be great if there was a sort of framework where anyone with any interest or need could say, I can think the cultural compact might be a way into getting some of my answers.
From my perspective, our cultural compact has always been the combination of all the different elements. I think when we first set it up, it was perceived that we were going to be this great godlike figure that was the font of all knowledge. We've really tried to shatter that illusion that we are only as good as all the different partners, and people like yourself who can bring expertise about your area. And then share that with others. We're seeing that now beginning to come to fruition through some of the training events that Alice is running. Rather than being led by the great expert up there, they're run by people like you, people who are practitioners. And I think that's far more relatable and in some instances more helpful, because a practitioner can understand what's gone through and understand another practitioner's journey and relate to that far more than strategic visions and all this grandiose language that some people use.
I think at that point, having facilitated the half-hour discussion very poorly, but there seemed to be so much enthusiasm, and I'm just hoping that you've all valued that as a collective discussion, but just want to leave a little bit of time for you to be able to go and ask some more challenging questions of individuals. I just really want to thank the panel. Thank you so much, coming to Shropshire, it's we're really delighted. I know Paul was really delighted to be able to host it here, but it's just we miss some of this, don't we? This getting together, and so I think quite a lot of other conversations can come. So thank you for your time and your enthusiasm and your openness.